a lot of people will be like, what's functional medicine? So how on earth did you become a functional medicine doctor? And what does it mean to you?
Okay, so functional medicine is a different way of looking about health and disease. So you could describe it as a sort of root cause analysis approach, a systems biology approach. It's essentially trying to identify and address the underlying causes of people's health issues rather than just treating symptoms.
Mm.
So there's pills for palliation, but they rarely address what's really going on under the surface. So functional medicine is a framework or a system of medicine that evaluates a patient in their environment, taking into consideration their whole being, and tries to understand what is it within that individual that is contributing or causing their health problems at the root. And a lot of the work centers around evaluation. So we take a lot of history, gathering information, running a lot of laboratory tests to try to understand what's really going on objectively. And then we intervene really through diet, lifestyle, like modifications, targeted nutritional supplementation, modifications to their diet, their environment, just to really give the body what it needs, get rid of all the things that are obstructing their innate health sort of expression, and hoping that we get much better outcomes than just focusing on symptoms alone. So it's really a way of thinking. It's a paradigm shift really when it comes to understanding why people get sick and how to recover them.
And so what would be some of the most common ailments that you get with people coming to you?
Yeah, most people come in with a whole list of symptoms, so it's never generally just one thing.
Okay.
But I would say some of the more common presentations I see would be energy problems, a lot of fatigue, tired all the time, usually combined with cognitive challenges, just foggy thinking, brain fog, forgetfulness.
So hard to know when you're actually like that as well. Because
It
you probably
is,
like
yeah.
it all the time.
Yeah, maybe it's a friend or family member that sort of, brings it to their attention.
Mm.
They'll often have, like the early signs of cognitive decline or just poor memory. They just forget where they put their keys and that kind of thing. There's a lot of gut issues I see. So a lot of people will have bloating and gas, bowel changes, reflux, constipation, diarrhea. They may have been given a diagnosis of IBS, irritable bowel syndrome, or maybe they have inflammatory bowel diseases. So gastrointestinal symptoms are a common presenting sort of, presentation, I should say. A lot of people also have hormonal type of symptoms. So it could be women with perimenopausal symptoms or postmenopausal symptoms, or men just feeling like their libido's down and their moods down, and they suspect maybe some sex hormone imbalances. It might relate to the thyroid gland and the thyroid hormones, which ties into low energy states and that kind of thing. But also, stress-related factors relating to stress hormones and adrenal function. So I would say gut problems, fatigue and energy problems, and cognitive issues and things would be the kind of like the main thing people see. But they'll often have other issues like skin complaints, joint aches and pains. I'm also an osteopath, as you know, so I do see a lot of patients that come in with chronic musculoskeletal pain, and their whole body's just inflamed, and they think it's a muscle problem or a joint problem. But oftentimes, when you dig deep into this, it's an inflammatory issue, often coming from poor diet and lifestyle, poor gut health, nutrient deficiencies. So we see a whole range of different issues, but I would say mainly centers around fatigue, hormones, and gut problems.